Greetings. Let us review proper disposal of various devices used during an endoscopy. The disposal protocol followed in an endoscopy suite. So let us go to a case. Here is a case, and as you can see, all the members are wearing proper PPE, and they participated in a procedure that required the use of an injection needle and also a biopsy forceps. Once the case is done, you need to do a few things. You need to remove your PPE and dispose the PPE in a proper bin. If you use a reusable gown that goes to the laundry for rewash, then you should put that reusable gown in the laundry bin. Otherwise, if it is a single-use gown, you throw it away in a waste bin or a biohazard bin, depending upon the contamination of the gown. Rest of the stuff, like a biopsy forceps, injection needle, packets that you remove to open up the biopsy forceps or the injection needle, those packets go into the waste bin. Any device that has been used during the procedure, especially the one that goes down the biopsy channel of the endoscope, that device is going to be contaminated. So it is a biohazard. So that device goes into the biohazard container. How about dealing with sharps? Injection needles, knives could pose serious risk to healthcare workers, and you need to set up the sharps container close to your operation so that you don't have to walk across the room with the sharp. And you may need a couple of sharp containers at either end of the room so that they can be easily accessed and avoid injuring anyone in the room. When you go to the sharps container, make sure that you check the container and make sure that it is not filled up to the brim. That will lead to an accident of an accidental puncture when you're trying to put your sharp in. So good idea to check your sharp container to see how far it is filled up, and then you drop your sharp horizontally into the slit. And once you drop, make sure that it has dropped into the bottom of the container and is not hung up at the top, because that could potentially cause injury to someone else who comes after you to deposit a sharp. So something to keep in mind. Do not put your fingers into the sharp container to push your sharp down. Avoid that mistake. So let us look at all the different devices or containers and tubing that we use, and what do we do in terms of disposing them. There are certain devices, containers and tubings that we need to dispose after every case, and these include a suction canister, it's a suction tubing, auxiliary water jet connector, air-water connecting tube. These are the ones that you need to dispose after every case and get a new set of tubings and suction container as well as auxiliary water jet connector for the next case. How about the rest of the stuff? The water jug or the water container for the auxiliary water jet and its tubing, air water bottle, the water bottle for air water lens cleaner, as well as tubing, can be disposed of at the end of the day. So these are the things that we need to do to keep infection control practice in a high standard. How do you dispose of the suction canister that has a lot of liquid material? This can be a serious biohazard if the liquid spills. You need to convert that liquid into solid by using a special chemical that you add, and that converts into solid waste. And this is treated solid medical waste that goes into the biohazard container. So we have learned about how to dispose of different types of instruments, accessories, tubings, and containers properly, and we also learned about how often should we do them and the precautions we need to take to prevent infection transmission. Thank you.